Let's take a moment to better describe the thoracic anatomy obtained when scanning in the transverse plane of imaging. The axial plane is here obtained in the lower thorax. The transverse plane of imaging of a chest CT will here be shown to illustrate the anatomical structures and orientation of this plane of cut. In an axial or transverse tomographic view, the superior part of the screen represents the ventral or anterior aspect of the patient. The inferior part of the screen represents the dorsal or posterior aspect. The left side of the screen represents the right aspect of the patient's body, and the right side of the screen represents the left side of the patient's body. The structures visualized in such a view are the right lung, left lung, heart, thoracic aorta, vertebral column, and sternum. As previously mentioned, assessment of the pleural space in the transverse plane is not optimal, as it does not provide adequate information about the relative position of the surrounding organs. Let's illustrate this point with an example. In a patient with a moderate right pleural effusion, scanning in the transverse plane just above the liver would show the effusion that could look significant. However, it will not show the liver, which is located just a few millimeters below the plane of imaging. In order to illustrate the exact orientation of the plane of cut, as it appears on the ultrasound system screen, the current ultrasound perspective has to be turned 90 degrees clockwise. The underlying chest CT scan image will help to keep you adequately oriented. Moving the ultrasound probe caudally will show the close proximity of the liver parenchyma. Compared to scanning in the transverse plane, scanning in the longitudinal plane, perpendicular to the ribs, will provide, in one plane of cut, an excellent view of the effusion and its location relative to the important surrounding organs, like the diaphragm, liver, and lung. This scanning plane will thus allow the clinician to assess the feasibility and safety of a thoracentesis. If the decision to tap or drain the effusion is taken, this view will allow for the determination of a safe area for needle insertion and trajectory, away from the main organs. By not providing a view of the surrounding structure in the scanning plane, the transverse view increases the risks of having an inadequate site and trajectory of needle insertion, thus increasing the risk of inducing organ injury that could potentially be catastrophic. To reinforce the concepts just described, we will show the right pleural view first obtained in the transverse plane and then by a 90-degree counterclockwise rotation in the longitudinal plane.